Have you ever wondered, does anxiety cause high blood pressure? Well, that's exactly what we're going to cover in this video. In more detail, here's what you can expect to learn. First, well, we're going to answer that question very directly. Then we'll talk about general stress. Does that cause hypertension? And we want to differentiate general stress from outright anxiety. Then we're going to look at other factors involved in the association between anxiety and high blood pressure. Does anxiety cause high blood pressure directly just through the mental stress of it, or does anxiety cause you to perform certain behaviors that cause high blood pressure? That's what we're going to look into. Before we jump in, who am I? My name is Igor. I'm the author of the Amazon best-selling book, High Blood Pressure Reversal Secrets, as well as the Mental Health Prescription. I've been a personal trainer since 2006, and I've been presenting at some of the world's largest personal training conferences since 2013 and training other personal trainers in my methodology. As well, I've delivered over 400 wellness presentations to some of Canada's largest corporations, including IBM, Bosch, American Express, University of Toronto, Investors Group, and others. If you want to learn when I publish more videos about exercise, nutrition, supplementation for high blood pressure or anxiety, click like and subscribe to my YouTube channel. And let's jump in. We know that when we're under stress, our pulse and blood pressure can increase. But does this short-term elevation in blood pressure lead to chronic hypertension? Well, that's what we want to find out. We also know that there's a relationship between anxiety and high blood pressure, not just stress, but outright generalized anxiety disorder. Here's a study that looks into it, but does that mean that anxiety causes high blood pressure? What's the nature of that relationship? Does one cause the other, or is there no relationship between the two? To examine this, what we need to do is we need to compare the levels of cardiovascular reactivity in people with hypertension and those without. Now, if you're wondering, what is cardiovascular reactivity? Cardiovascular reactivity is the degree by which your pulse and your blood pressure increase in response to a stressor. Now, what does that mean? What kind of stressors? Well, the way that they study this in research, because they can't use like financial stressors and stuff like that in studies, they'll stress people in other ways by submerging their hands and or their feet in very cold water. They'll give them a puzzle to do with unrealistic deadlines, or they'll have them speak in public in front of an audience and judges. And so those are the stressors used. Here's a study titled, Does Anxiety or Cardiovascular Reactivity Have a Causal Role in Hypertension? And the reason I like this study is because it differentiates between association and causation. Just because two factors are associated with each other doesn't mean that one causes the other. So here were the results. They looked at people with cardiovascular reactivity in people with hypertension and people without hypertension. And what they found was that, that cardiovascular reactivity was identical. So no difference. How interesting is that? And so anxiety doesn't cause hypertension, but maybe general stress does. Well, let's look at a study on that. Here's a study titled Self-Reported Stressors and Hypertension, Evidence of an Inverse Association. What that means is this. Basically, people who are under chronic stress but don't have generalized anxiety disorder actually tend towards lower blood pressure, not high blood pressure. So isn't that interesting? So why the association between anxiety and high blood pressure if anxiety doesn't cause high blood pressure? Well, here is another study that tried to examine this. It's actually a meta-analysis. It's titled, Greater Cardiovascular Responses to Laboratory Mental Stress Are Associated with Poor Subsequent Cardiovascular risk status. Here's what they found. First of all, when anxiety is high, it makes you do or avoid doing certain behaviors that cause good health or in lower blood pressure. Like if your anxiety is high, you're less likely to exercise. If your anxiety is high, you're also likely to engage in more self-soothing behaviors like eating food that isn't good for you, or smoking, or drinking alcohol. None of these things are good for your high blood pressure. So the explanation is a lot simpler than that. Just because you're mentally stressed and you have an elevation in your blood pressure and heart rate for a few minutes to hours, that's not a causal factor in chronic hypertension. It's more these things that anxiety makes you do, like lack of exercise, eating bad food, smoking, and drinking. If you want to learn way more about high blood pressure, that's exercise, nutrition, supplementation, including the best foods, the worst foods, and others, check out the playlist on your screen right now or in the description below.